Good morning, everybody. New South Wales has reached 6.8 million jabs, which is an outstanding result. 66% of our population, so nearly two-thirds of all of our citizens, adult population, have had one dose, and 36% have had two doses. Last night to 8 p.m, we had 1,290 cases of community transmission, and again, more than 80% of these are in southwestern and Western Sydney. And in terms of the regions, there's stabilisation across rural and regional New South Wales, but Western New South Wales, as the Deputy Premier will outline, remains a concern for us. Overnight, we unfortunately had 4 deaths, and we again extend our deepest condolences to the loved ones of the people who've passed away. And again, whilst every day we read out the statistics, we know that behind every death is a family and those who are mourning. So we extend our thoughts to them. A male in his 50s in Dubbo passed away, a female in her 60s, and 2 males in their 70s, and Dr. Chant will give further information about that. As I've been saying in the last couple of weeks, whilst it's important for us to do everything we can to reduce those case numbers, we know that the greatest way to do that is getting vaccinated. Vaccination is the key for us in terms of our freedoms and in terms of reducing the rate of spread of the virus. The other number that's really critical for us to look at is the rate of hospitalisation. And it stands to reason that when you have more people fully vaccinated, you are likely to see the rate of hospitalisation and the rate of people in intensive care decline. And that's a number we're also looking at, and I'll have further to say about that in the coming days. I also want to take this opportunity for all of us to think about our frontline workers, our frontline health workers that put their own safety and health on the line to support the health and safety of all of us. And today I'm so proud to have with us Joe Ibrahim from the New South Wales Ambulance Service, from the paramedics, who'll speak about his personal experience, the experience of his colleagues, and his message to all of us as a frontline health worker. Again, our message is get vaccinated. We're doing so well in terms of our vaccination rates, and we're also doing very well in terms of planning for our roadmap. As we've said, we want citizens and industry to start preparing their COVID safety plans, to start making sure that they're fully vaccinated, to start making sure that all of us appreciate that come 70% double dose, which will happen at some stage in October, that those freedoms will extend to people who are fully vaccinated. Dr. Chant will now give her health update, then the Deputy Premier will talk about the regions, and then Joe Ibrahim will talk about his experience as a frontline health worker. Thank you.
There were 1,290 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were 3 overseas acquired cases. It's pleasing to see those testing numbers maintained at that high level. There were 157,221 tests, so thank you to everyone for coming forward. There are currently 840 COVID cases admitted to hospital, and 137 people are in intensive care, 48 who require ventilation. As the Premier has said, sadly, New South Wales Health has been notified of the deaths of 4 people who had COVID. A gentleman in his 50s from Dubbo died at Dubbo Hospital, and he had significant underlying health conditions. A man in his 70s from Western Sydney died at Westmead Hospital. Again, he also had underlying health conditions. A gentleman in his 70s from Sydney's Inner West died at Concord Hospital, and he'd acquired his infection at the Meredith House Aged Care Facility and is the first death linked to this outbreak. And there was a woman in her 60s from Western Sydney who died at Westmead Hospital, and she acquired her infection at Cumberland Hospital. Can I just extend my personal sympathies to the families? Every time we read out these names, there is a family that is grieving. In terms of the suburbs of concern, it's Guildford, Marylands, Auburn, Greenacre, Yagoona, Punchbowl, Blacktown and surrounding suburbs. We are still seeing such a high case rate from those suburbs. So I can't urge you enough to please come forward for testing, but importantly be very careful in the way you move about in your community and follow those public health measures. We're also seeing some spillover into adjacent local government areas, and that's usually from workers going into those local government areas of concern and bringing it back and infecting the families. So a particular call out to Ryde and Meadowbank and some of the inner west suburbs such as Marrickville, where we are seeing the introduction into factories and other workplace settings. So please, it is important that all workplaces consider their COVID-safe plans. Make sure you're not having those shared tea rooms. Make sure you've got diligent mask wearing at all times. Make sure you've got the 1 per 4 square metre density compliance. Please make sure that you do everything you can, and make sure that workers do not attend when they have symptoms. In terms of the sewage surveillance, we've had positive detections in Trangie, in Western New South Wales and Byron Bay, and both of these sewage treatment plants have not got any known cases. So again, we're very concerned, and please come forward for testing. Can I just echo the Premier's comments about vaccination? The vaccines work. They are highly effective. They help individuals. They help you from passing it on to the other people that you love. Can I urge everyone to get vaccinated as quickly as possible? Access across the state is increasing. Please get vaccinated as soon as possible.
Well, good morning. I too start by offering my condolences to those families that lost loved ones overnight. You remain in our thoughts and prayers, especially in this recent outbreak. We've had our first loss in regional rural New South Wales overnight in Dubbo. We've touched on sewage surveillance, especially in Trangie and Byron Bay. Again, of concern. We've seen previously through that surveillance, we've been able to identify cases. Again, those committees, be alert. In relation to cases up to 8 p.m. last night in the far west, there were 9 cases. 7 were in Wilcannia, 2 in Broken Hill. Western New South Wales Local Health District, again concerning 51 new cases. 33 were in Dubbo, 4 in Burke, 5 in Bathurst, 1 in Narromine, 1 in Blaney, 1 in Brewarrina, 2 in Forbes, 2 in Orange and 2 in Parks. We also have got some concerns around some unlinked cases. So for the communities of Burke, Brewarrina and Gonia, if you have any symptoms, please come out and get tested. In the Hunter, New England area, there were 3 new cases overnight, 2 in the Lake Macquarie local government area and 1 in the Cessnock local government area. The Illawarra Shoalhaven, again, we saw 5 new cases, 3 in the Wollongong local government area and 2 in the Shell Harbour local government area. And we had 6 new cases overnight on the Central Coast. So again, to those communities, be alert of what's occurring in your community. Any symptoms, please come out and get tested. I noticed on the weekend in Moree, we had a walk-in vaccination hub. 428 people came forward for vaccination, which was a fantastic result. 82% of them were first doses. In the next 2.5 weeks, we'll have more walk-in clinics where you don't need a booking in Goulburn, Batemans Bay, Cooma and Queanbeyan. Again, an opportunity for regional communities to keep getting vaccinated. I want to call out for Bega. 70% of the Bega community have now got their first dose, 42.2% their second dose, and in Wagga, 60.6% first dose and 37.2% second dose. Again, a strong message to the regions about getting vaccinated, but more importantly, also be alert and come forward and get tested. Thank you.
Good morning. Good morning, everyone. My name's Joe Brim, and I'm an inspector and an intensive care paramedic with New South Wales Ambulance, and I work on the front line in Western Sydney. I've come here today because I wanted to give you all a little bit of perspective surrounding what our paramedics face and do on every single shift, and to echo the message about getting vaccinated. In getting vaccinated, you are not only looking after your own health, you're looking after your neighbours, your community, and you're looking after us as frontline health workers. Our role as paramedics is physically and mentally demanding. One of the most physically demanding things we do is perform CPR. In the current climate, we need to perform CPR in full PPE. To give you an understanding of what that is, we are wrapped up in a plastic gown that is not breathable. We've got a fit-tested mask that covers our mouth and our nose and often digs into our skin to ensure that the contagious nature of this virus doesn't get into our lungs. We've got our glasses on and we've got gloves on. We wear this for the majority of our 12-hour shift, and it takes its toll. We wear this to not only protect us, but to protect our family, to protect the broader community and your family. When I joined this profession years ago now, I knew that it came with a level of risk to serve our community. For the very first time, though, I'm now bringing this risk due to this contagious virus home to my wife and my beautiful boys. I know and take comfort in the fact that vaccinations break the chain of transmission, and I'm grateful to be vaccinated. This truly does give me comfort. And this is another reason why I stand here today asking you all to go and get vaccinated. Our primary role as healthcare professionals, particularly in an emergency setting, is to take care of our patients in their time of need. But paramedics are compassionate by nature. That's what draws them to the job. The compassion that paramedics show towards our patients doesn't end at our patients. It also goes on to their family, and often we're a shoulder to cry on for their family members. I'd just like to share a case with you that I very recently attended in Western Sydney. I was called as the intensive care paramedic to back up a crew that was at a single mother with her teenage son and daughter in the house, and she was deteriorating. When I got there, I integrated with the team and I provided her time-critical treatment. But whilst doing so, her son made a comment to me. And that comment was, "I think this is my fault. I think I've given Mum COVID." That stopped me in my tracks, and it stopped my team in my tracks, and it absolutely broke our heart. Unfortunately, this incident is not isolated. This is what paramedics see on the front line every single day. Whilst paramedics are absolutely available to respond to you in medical emergencies and at your time of need, our preference is that you stay healthy and that you don't need to meet me or one of my team, and that you don't need to be in the back of one of our ambulances. As a father, as a paramedic, and as a member of Western Sydney's community, I stand here quite emotively, as I'm sure you can see, and I'm asking you to follow the rules, stay at home, go and get your vaccines, because that's what's going to help us. On that topic, I just want to take just a moment to acknowledge our amazing control centre staff. I also want to take a moment to acknowledge our support staff that help us deliver to you the resources that are ambulances every day. And of course, the incredible paramedics that, despite all of these changes and challenges, and that they are tired, but you know what, they front up to work day in, day out, and they give it their absolute all to respond to the community and to treat you. Lastly, I'd just like to make an observation. The people of New South Wales are resilient. In times of need, we're here to help each other. I've been privileged and honoured to work in the community in droughts, in catastrophic bushfires, and in floods. And in those times, every time, in my experience, the people of New South Wales come together, they turn up, they help each other, they help themselves, and they help us as frontline workers. Now, we're calling on you again. We need your help. The way to fight this virus is to get vaccinated. Thank you.
Bringing up, New South Wales now 66% full dose, 10 deaths in the last 2 days, hospitalisations and deaths, which you say what counts are clearly going up. What strategy have you got in place for when we open up at 70 and 80% vaccination and there are more hospitalisations and deaths?
Well, the important thing to note is when we get to 70% double dose, the freedoms that we'll be experiencing will be those who are fully vaccinated. We know that the risk of having or developing severe illness is reduced when you're fully vaccinated. The risk of you getting the virus or passing it on to others is severely reduced when you're vaccinated, but also at 70% double dose, there'll still be restrictions in place. You'll have to check in, you'll have to demonstrate you've been vaccinated, you'll have to demonstrate social distancing, you'll have to make sure that in certain settings you're wearing a mask. So know that at 70% double dose, life will be much better than what it is today if you're vaccinated. But having said that, we'll also make sure that we never ever have any settings which overwhelm our hospital system. And we know that is the absolute challenge. And please know that every day when the case numbers come out, the more people who are double dose vaccinated in those case numbers, the more resilient they'll be and the less chance that they'll have to go into hospital. And that's really important to note. As our vaccination rates go up, the hospitalisation rate of cases is likely to come down, and that's something we're keeping a close watch on. We will never, ever have settings in place which are going to overwhelm our health system, which are going to overwhelm our paramedics or overwhelm our intensive care units, and that's what we watch very closely. We also have to remember this important point, that COVID will be with us, we don't know for how long. And what we need to do as a state is demonstrate our pathway out to living with the virus. And that pathway for us starts in earnest when we have 70% double dose vaccination. And then obviously there are further positives once we get to 80% double dose vaccination. And these are important targets. But that's why I say the most relevant figure for us is keeping an eye on how many people require hospital care and how many people require intensive care.
Require hospitalisation and require treatment in the ICU necessarily going to increase as case numbers increase, because only 36% of the population is double vaccinated.
Well, as I said yesterday and I've said previously, we anticipate that the worst month, the worst time for our intensive care pressure will be in October. And the number of cases we have in intensive care then will depend on our vaccination rate and will also depend on the number of cases. And we all have a hand in determining what that looks like. And I can't thank enough the tens of thousands of people that are coming forward every single day in our state. I mean, we're getting close to 900,000 jabs a week in New South Wales out of a population of 8 million. That is outstanding. But every day that we get closer to hitting those vaccination targets means that the pressure on our hospital system, the pressure on our ICU will decline over time, and that's what we need to manage. Some countries who open up too early, some countries who open up too freely see their hospitals overwhelmed, and the challenge for any society dealing with COVID, and other states will go through this, because when they open up at 70% or 80%, get their borders down, other states are going to have to deal with this as well. And it's really important to make sure that at all times, and that's why I'm very keen to make sure not only do our case numbers go down, but the most important numbers we look at the moment are how many of those case numbers are needing hospitalisation and how many are ending up in intensive care. I'm sorry, I didn't get the first one.
If you looked at modelling that looks at October, that is going to be our worst month, and said what is the best case scenario and the worst case scenario when it comes to hospitalisations and deaths?
Look, there's various models that exist, and every time that we get modelling, it has lots of what we call variables. It depends on a whole bunch of things. But what we do know is that at this stage, we're hopeful that once we get those vaccination rates up, the rate of hospitalisation declines. But we also know from the information we have, the accumulation of cases and also the number that are still unvaccinated, that October is likely to be our worst month in terms of pressure on the system, and that's why we're gearing up for that. We have been for nearly 2 years. Can I state again, our hospital system is under pressure. Will we need to do things differently? Of course we will. Will we need to manage things differently? We're in the middle of a pandemic, of course. But will we cope? Of course we will. And that's why we're keeping a keen eye on those figures. But it's important to note, even after you get to 80% double dose, we're going to see more cases. But if the majority of our population is vaccinated, the majority of those cases won't need to be in hospital. And that's why it's really important to focus on those numbers, because that is what will make sure that our hospital system isn't overwhelmed. That's what will make sure families aren't distressed by having COVID, members of their family get COVID in a severe way. And that's why it's really important for us to have the conversation now. I don't expect the public, our citizens, to suddenly have a change in mindset when we get to 70% double doses. That's why we're very keen as a government and as a team in New South Wales to make sure our citizens are privy to this conversation now, because life will change once we get to 70% double dose. And I don't want people to be confronted by that. I'd rather we have a process where we become accustomed to what life with COVID looks like and feels like, and it should feel much less scary and much more hopeful as those vaccination rates go up. And I want us to beat every record on the planet in terms of what proportion of our population is vaccinated. And I just want to thank everybody for being so responsive. Even when we've asked certain categories of workers to get vaccinated, when we've asked professions to come back and make sure they're vaccinated, we've been overwhelmed by the vast majority of our citizens supporting us. And that is what gives me absolute hope that we can lead and show the way by bringing everybody with us, but reducing, I mean, what really breaks my heart is seeing people in intensive care, because you can't have visitors. It puts pressure on our staff. The families would be in enormous distress, and that's what breaks my heart. Every time you hear about a case in intensive care, whether or not the outcome is a positive one, just the fact that somebody has to go through that, and then the team around them, the staff, the frontline health workers, all the support staff have to experience that is a devastating blow. And so we're working hard to reduce that number as much as we can.
Is it realistic kids can be in school in October and we could have outdoor dining?
But remember, the hospitalisation rate doesn't necessarily relate to transmission. What that is a demonstration of the accumulation of cases over time. And know that once we get to October, once we get to 70% double dose, the chances of our citizens, a proportion of our citizens ending up in hospital or ending up in intensive care greatly reduces. So we have to be aware of those facts. The rate of hospitalisation, the rate of people going into intensive care goes down every time the vaccination rates go up. So Dr. Chand and I and the Minister, we actually use the word joy when we see the vaccination rates go up, because that gives us heart that we are protecting more of our citizens are being protected. The vaccination is the best armour we have in protecting people against COVID, but also in living a normal life. All of us have to accept, as confronting as it is, that we don't know how long COVID will be with us. But what I do know is that we will find a safe spot where we can live freely and have as few of us end up in intensive care as possible. And the double dose vaccination is the best chance we have in keeping ourselves and our loved ones and our health workers safe by staying out of hospital.
What about in the next 2 weeks or the next 4 weeks? We've got 1,200 cases today. You'd expect in about 2 weeks that ICU numbers will go up a lot, and also those people aren't vaccinated. We haven't hit those milestones for vaccination. So what is the plan for the next 2 weeks, next 4 weeks?
Just to put things into perspective, about 18 months ago when the pandemic started in earnest, we quadrupled pretty much our ICU capacity. We purchased, or we have around 2,000 ventilators, as Dr. Chant read out. People on ventilators is always tragic, but it's still a relatively low number. So the health system is prepared, but will it be stretched? Absolutely. Will some hospitals be overwhelmed? Well, it's stretched now, but there's capacity across the network. We are one network, and as all the specialists, and you don't have to believe me, but every time a health professional explains the plans and what's happening moving forward, we have a network in New South Wales where resources can be moved around, where specialists can move around. That is what you do when you're planning in a pandemic. These aren't normal circumstances. This is a pandemic. I'm not going to pretend this is situation normal. When you're in the middle of a pandemic, when you're racing to vaccinate your population, we can't pretend that this is normal. It's not normal. But what our aim is to get to normal, is to get to a place where we live with the virus, we keep people out of hospital, and we have a relatively free life with safety restrictions in place. You see?
We're hearing every day, though, from countless healthcare professionals and nurses and doctors, and they say that they don't think that they are coping, and they are concerned about the next 2 weeks. So when these numbers keep rising every day, I guess, what do you say to those healthcare professionals who are concerned that the system isn't coping?
Oh, look, I'm sure there are always people who are going to be concerned about that, but equally there are people who've been involved in the planning for the last 18 months and are well aware of what to expect. Our health experts are some of the best in the world. Our ICU specialists, our emergency department specialists are some of the best in the world, and they've been planning and training to deal with what we're likely to expect in the next couple of months. And I can't thank them enough. And that is why, as a government, we've made sure, and I know Minister Hazzard has appreciated this as well as Dr. Chant and the health team, we've invested extra billions of dollars to support that increased capacity. We've invested in staff, we've invested in training, we've invested in PPE, in ventilators, all those things that we need. Now, obviously, our aim is always to keep people out of hospital, to keep people out of ICU, and the best thing we can do is to increase our vaccination rates because, as I said, as the cases every day are announced, what really matters is what proportion of those cases are double dose vaccinated, what proportion of those cases won't end up in hospital, what proportion of those cases can stay at home and recover. And they're the important questions to ask because that gives us good insight into what we need in the next few months. And I just want all of our citizens to know that we hope you don't need hospitalisation. We hope you don't need to go into intensive care. But if you do, we have some of the most professional health workers anywhere, and they will take care of you. But we'd prefer that didn't happen, as Mr Ibrahim said much more eloquently than I can, to protect people like him and protect his profession and protect our loved ones. Let's get vaccinated, both doses, and stay out of those situations.
Will residents in the hotspot councils who are double vaxxed get the same freedoms as people outside of those hotspots?
Well, what I'm clear about is to say that when we get 70% double dose vaccinations, each and every one of our citizens will enjoy a freer existence. Well, we're working through all of the roadmap as we speak, and please know that New South Wales is working towards a roadmap as to what that 70% looks like. But we also have to appreciate the next few weeks are also critical. The next 2 or 3 weeks will give us good guidance as to what level of freedom we'll have at 70% double dose. But my strongest message is, if you're not vaccinated and have no reason to be unvaccinated, don't expect to have freedoms at 70%. Please know that those freedoms at 70% double dose will be extended to those that are vaccinated because we want to protect those members of our community who aren't vaccinated and also protect those who are especially vulnerable because we also know there's a small percentage of people who have underlying health conditions, who are already ill, and even a vaccination, whilst it helps them, it may still cause them grief. And so we have to be mindful of our vulnerable communities in particular, or those with underlying conditions. A follow-up, yep.
The LGA areas of concern list, some could be added and some could be removed.
Correct.
In order to be removed, what's that going to take? Case numbers are going to have to come down.
Well, there's obviously...
So just further to that,
yeah.
What's your message to those people?
That was a 3 follow-up.
Well, it's
yeah.
an extension of the same question. Yeah. How do you think they feel when you say don't focus on the case numbers, when their day-to-day existence is so dependent upon them coming down?
Well, actually, it's a whole range of things we look at. We look at vaccination rates, and we actually have conversations on a daily basis without raising too many expectations. There are a couple of local government areas that we're considering taking out of those areas of concern. And I do want to stress that. A few local government areas have had a reduction or stabilisation in case numbers, very high rates of vaccination. And these are the opportunities we have to look at, and that obviously depends on the health advice. But I do want to foreshadow that there are a couple of LGAs who are experiencing a drop in numbers, a good stabilisation, but also, I don't want to speculate, but also on the converse, there could be areas, as Dr. Chant mentioned, where there's spillover of cases. So we just ask everybody to be on guard. We want to lift the burden of our citizens, not increase the burden, and higher vaccination rates give us that flexibility, because even if your community has some case numbers, but if we know that a lot of you have had your first and second dose, that gives us greater flexibility in increasing your freedoms.
On Friday, the back clip in relation to rapid antigen testing, you told businesses in the LGAs they needed to have rapid antigen testing if they wanted to leave or be vaccinated. Friday, 8 p.m, you decide rapid antigen testing's off the table.
Yeah.
That cost businesses thousands of dollars to bring it in, and now it's what happened there?
Yeah, I'll ask Dr. Chant to explain that.
So clearly our key policy driver for that decision was to get people vaccinated. We really want the vaccination of authorised workers, we want our disability workers and our childcare workers. And that's because we're seeing those impacting on workplaces, but also impacting on very vulnerable people. We had given the options of RAT testing in some circumstances, but obviously the RAT testing is more able to be implemented because of the TGA requirements where you need to have some supervision in larger workplaces. So the feedback we'd got in relation to it is firms that had 5 employees really struggled with implementation of the RAT testing, But so what we did was remove that. But can I say, I would have a strong expectation that if you wanted to keep your workmates safe and your workplace functional, get those workers vaccinated, those 5 workers. And I know a lot of industry, and thank you to industry, have set up the RAT testing, and that has been so useful in particularly our critical infrastructure, situations like aged care. It gives us that added assurance, because the last thing we want to be dealing with is having a worker positive in those settings, which might interrupt critical food supply chains or actually aged care residents, who are one of the most vulnerable groups.
But the issue is that you made a rule on one Friday and reversed the rule on the next Friday. These businesses spent money putting it in place.
Well, can I just suggest that if the businesses put it in place, it's actually your insurance policy, because when you get a case in your workplace, you will have prevented that workplace being closed down, in most cases for something like 14 days. And so the workplaces, I would actually encourage people to, where it is appropriate and fit for purpose, for them to have the RAT testing if they've got critical work or it is critical that they can't stop their business. Because otherwise you're going to have a worker come into your place and you're going to take out a large number of your workplace. And that's why so many businesses have chosen to put in that additional measure, risk mitigation of that.
Dr. Chan, you mentioned workplaces in Meadowbank and Ryde. What are you actually seeing going wrong there?
So just to clarify that, what we're seeing is obviously workers go into local areas of concern and workers go out. And you can imagine that the flows are greatest in adjacent local government areas because people generally choose to live in the vicinity of their working. So I suppose the point I'm saying is we're seeing a lot of spillover of the fact that workers live in adjacent areas such as Ryde, Meadowbank. They might live in the inner west and they might travel in, or the workers again from that area might be travelling into inner west and adjacent suburbs. And that's what we've seen in relation to some of the other local government areas that the Premier indicated, which was around Bayside and Georges River, where we're seeing one end of those local government areas largely having the high case numbers, and it tends to be where the workers and the intersection with those other local government areas of concern. I would like to say that everyone needs to feel the COVID risks because people do, by necessity, move around, and no one can assume that they're in an area where there isn't any COVID cases.
So businesses need to buy these antigen tests, right, if they want to put it in place in their firm. Does Health have antigen tests that you can give to businesses like for free? And also, does that TGA ruling on needing medical supervision, should that go?
So I would see that businesses assess their business risks. If you're a couple of people and you're working outside, then that's really not an issue. The best protection is vaccination. But I know a lot of industries have chosen to adopt rapid antigen testing as another defence to keep critical business operations in place. And so those industries will make their decisions about that, and there is a TGA requirement that there's some supervision. Look, we respect the TGA. I know this TGA will continue to monitor this, and the evidence for how our businesses, how the RAT testing rollout in New South Wales is going, including aged care pilots and the pilots in industry, including construction, I think will inform the sort of settings and the models that we need into the future. Because in the end, even when we are 80% double vaccinated, we will potentially still want to protect very vulnerable settings. And what we're learning at the moment, and I just need to be frank, we are learning all the time about how do we adopt some of the technology that's been used overseas, where the settings are that technology works well, and how to use it. And we're going to have to do that as we live with COVID into the future. And I see that RAT testing may have a place ongoing in critical high-risk industries and also very vulnerable settings where you really want to assess someone's status quite quickly. Now, remember, RAT testing needs to be done regularly, and it is not for symptomatic people. It is basically another control.
Dr. Chan, we understand that the death in Dubbo was in an Indigenous man. Obviously, there was a lot of concern about the virus getting into those vulnerable communities where there was low vaccination. Are you going to look at this particular death and investigate the circumstances?
Look, I'm not in a position to confirm the nature of the person who died or give out any other medical conditions without first talking to the family. So let me just say that that is the approach I'm taking. Certainly any death is tragic, and we're particularly concerned about the case numbers in far west and western New South Wales because of the overrepresentation of Aboriginal people and the likelihood that COVID will be and is touching Aboriginal people disproportionately. And for that, we need to use everything we can. I would also like to say that there are very strong vaccination efforts in those local communities, and I call upon all community leaders to really encourage high uptake, and I've been very pleased that some of the towns have had incredible uptake, and I want to thank the Aboriginal AMSs, the Aboriginal Medical Services, who have been doing such a good job with the Royal Flying Doctor and other services such as the AUSMAT team in getting those vaccination levels high.
Dr. Chan, you've been worried...
Dr. Chan, quickly.
I know we're focused on double vaccination, but we're now watching countries like Israel see their cases surge despite high vaccination rates. How important are boosters to maintaining this no lockdown plan, and how soon we need to get them so that we can maintain these freedoms we're being promised?
We need to get used to being vaccinated with COVID vaccines for the future. I can't see that COVID is not going to be with us forever. Maybe in the future we can have even better vaccines and coverage across the world to achieve that. I mean, as a public health doctor, we always want to have diseases get totally eliminated, but that's not on the horizon in the near future. So booster doses, repeat doses will be part of it. You know, there'll be different advice about different schedules, which doses you get. But at the moment, our priority has to be getting first and second doses into people, and there will be recommendations about booster doses in the future. And I can assure you that the Commonwealth Government has purchased large quantities of vaccine into 2022, and this will be a regular cycle of vaccination and revaccination as we learn more about when immunity wanes.
Dr. Chan, Dr. Chan.
There's obviously concern around prison. There's a lot of prisons on high alert. How concerned are you that COVID's got into prisons?
Clearly, I'm very concerned about prisons. And I think I highlighted the fact that they're really one of the targets for our vaccination efforts. Obviously, it's a complex operational environment. People are living in close quarters. Obviously, people are coming into work in those prisons. COVID can be introduced. We also have high turnover. So again, prisons is something that we would also see potentially a role for rat testing and other testing. And I know that they've been testing people and isolating them when they go into prisons in order to try and prevent COVID being introduced. Vaccination will be the key, and we're certainly looking at opportunities to ramp up vaccination as well as having a very strong public health response, which is just things like locking down prisons, making sure that you minimise any movement, looking at any learnings in the very strong COVID safe plans that have been put in place for prisons. What more can we do to keep them safe?
Extra doses to Randwick. People in the hotspots of Western Sydney are saying, why are they getting extra doses and yet not getting extra restrictions if you are as concerned as you are about Randwick? So is there any...
I think Minister Hazzard has some information on that.
Look, I did see the article this morning. It's not accurate. The South Eastern Sydney put out a tweet yesterday just letting people know that they had some available vaccine because there were a number of no-shows. So they were just making sure, as all of the LHDs do, that the vaccine would be offered and taken up. So not entirely accurate, but anyway, I think the main message here is that our frontline staff who are out there vaccinating want you to come in and get a jab in your arm, and they will make sure that if they have a vaccine because somebody has failed to show, they'll make sure they get the messages out, and that's what they're doing. So, as we've heard many times, this virus is here to do whatever it can possibly do to us, but what we can do to it is get vaccinated. So please, go and get vaccinated.
Premier, can I just ask, what plans do you have in place for the hospital system? Could we end up seeing a field hospital in Sydney? Because in the UK, they opened up at 80% vax and they have 100 deaths a day. Clearly there's going to be a lot more hospitalisations.
I'll refer to Minister Hazard, but can I make this point? Other countries that opened up at certain vaccination rates did not have any restrictions in place. Many countries didn't use QR codes, didn't use vaccination passports, didn't use density requirements or social distancing requirements. So when we're comparing, let's make sure we're comparing apples to apples. And the second point I'll make is that, as the experts have told us, we will not require those type of field hospital arrangements given the way that we've planned, but I will ask Minister Hazard to expand on that.
Well, look, this issue has been raised quite a few times, and I'll just say again what I've said in the past. The health advice is that we have substantial capacity in our hospitals, and that capacity to have not only wards, patients in wards, but also in ICUs is where the focus should be. We spent a lot of time last year, or the health system spent a lot of time last year, the doctors, nurses, administrators, looking to see what numbers might come in through the course of the pandemic, and we have taken steps to make sure, for example, that there are private hospitals, world-class private hospitals, that are on standby now for any increase in patients where we need to do it. So field hospitals would be not on the agenda at all at the present time. Can I say just further, some of the measures that we took last year on health advice were issues like increasing by quadrupling the number of ventilators in New South Wales. So it went from about 500 ventilators to 2012 was last I looked. And of course a lot of health staff that worked in, for example, might have been usually working in operating theatres, have been trained up to work in ICUs as well. I know when I spoke to some of those staff, they were really happy that they'd finally had an opportunity to find out what happened in other parts of the hospital. Hospitals are like, as has been referred to on a number of occasions, like very large aircraft carriers, and the person at the stern doesn't necessarily know the person at the bow. But we do now know that because there's a lot of extra staff who've got a lot of extra training to be able to step up. So the health system is ready in New South Wales, but as has been said by our paramedic here today and other staff who've been here before, they do not want to see you. Our health staff don't want to see you in our hospitals or in our ICUs. So, can I just finish, please? So please go and get vaccinated. Yes. Oh, hang on. I'll just take this from James, please.
The federal government extended eligibility for the Pfizer vaccine.
Sorry, James, I just can't hear you.
Anyone between 16 and 39 was made eligible by the federal government for Pfizer. They're doing it in other states. What's going on in New South Wales? Can anyone in New South Wales 16 to 39 get Pfizer, or just the LGAs of concern?
No, anybody. Yeah, absolutely.
Is there enough Pfizer available?
No. If we had, let's make it real. Let's make it very, very clear. Even though this must be about the 500th press conference where we've said these sorts of issues. Pfizer is actually not in abundant supplies. AstraZeneca is. The Premier had it. I had it. Dr. Chant had it. AstraZeneca is a perfectly good vaccine. It's been used right across the world. And my strong advice, when we're in a breakout of the viruses we have at the moment, is go and get whatever vaccine you can get. They're both very, very good vaccines. But for those who have a preference for a number of reasons for Pfizer, well, they'll have to wait. But my advice and the health team's advice is don't wait, because you could be the next person in the intensive care unit, and you could be the person who's actually exposing our health team to the virus, and you could be the person who dies. So go and get whatever vaccine's available. Sorry, you asked something to Dr. Chant, was it? Dr. Chant.
Just a couple of questions on contact tracing. Can you describe how the operation of contact tracing has changed, if it has, from cases in the tens to above 1,000? Has it changed much?
It's had to change a lot.
And how has it done?
Okay. Okay. So what we've done now, and I think I've announced this a week or so ago, is that we're doing a text message to individuals as soon as the positive test comes in, they're batched, and we're regularly texting out to people. That gives people information about the fact that they need to isolate. They also need to get all of their household members to be immediately isolating, and it also gives them very relevant information and fact sheets. And we also embed in that a questionnaire which says, are you a household contact and already isolating, or do you work in a workplace, an aged care facility or something like that? So we're using a questionnaire embedded in that link to actually allow us to reprioritise, because obviously getting to a person who is a household contact, who's already been in isolation, who hasn't posed a risk to anyone else that's turned and become positive, doesn't represent a public health risk. What we need to do is focus on those people that have been in workplaces or active in the community. So can I thank everyone? Obviously, we're not getting 100% response to that questionnaire, but that's allowing us to risk assess. In addition, we are also making sure that some of the work that the public health teams were doing initially is being done. So some of the clinical care follow-up and referral processes have been streamlined. So just be reassured that we're looking all at the time about both scaling but also increasing the efficiency of our contact tracing.
Dr. Chan.
In July, you got the ref in Fairfield below 1. You had it below 1 for a couple of weeks, then you lost control of it. What happened there?
I think what we know with the COVID virus is the fact that you can... there is the global R effective numbers, and there's a global mobility which is generated by mobility and other things. But in the end, there sometimes are drivers for the transmission, and if you don't break those drivers of the transmission, then you see case numbers go up. So I think that's been one of the issues. Certainly, we've had to learn about Delta and how it transmits, but one of the key issues is it transmits very effectively in households, and it transmits much more easily in workplaces than we've seen other viruses. And hence, we're going to have that extra armour of protection, which is the vaccine, and also COVID-safe plans. You know, we're not going to be going back to pre-COVID times. We're going to have to learn how to carefully live with a virus which causes severe illness and death. But that's what we're going to have to continue to grapple with.
The chant for an area like Burwood to come out of the areas of concern. I think they had 0 cases on Friday.
Well, we're looking at the data every day and we review it after the weekend. The issues for us are we look at the case rate in those areas. One day does not make a trend. So we are looking at all of those, and what I've also been pleased to see is the Burwood immunisation rate has actually shot up very high as well. So what we look at is immunisation coverage, case numbers, where those cases are coming from. How are they being generated? Are they in family groups? What's the acquisition mode? And then the other things we look at is whether it's evenly distributed across the local government area, and think about some of those issues around ongoing seeding and concern we might have.
79 deaths occurred in August with COVID. If October is going to be the worst month, if October is going to be when ICU and deaths peak, how much higher than 79 will the monthly deaths be in September and October?
I mean, clearly, as long as case numbers continue to go along, we are going to see tragically deaths. What I think we are clearly saying is we have to maintain these restrictions. We've got very significant restrictions. We need to maintain compliance, and we need to get vaccine in arms. The best protection people have is get vaccinated. 1 dose stops transmission and has some impact on hospitalisations. I can't stress it enough that we have to get vaccinated. We have to get that 2nd dose vaccine coverage to give us the greatest protection. So, and also, I have heard anecdotally that some of the appointments, when you've managed to get another appointment, please cancel your previous appointment, because I don't want to see any spot going vacant for a jab in arms. So please do the right thing if you happen to have got an earlier appointment, and please bring ahead your second appointment for your second dose, because we need to get that in. And remember, there is a lag. Can I just say there is 2 to 3 weeks lag before the second dose kicks in. So the earlier we get don't delay, get vaccinated, get your second vaccine as soon as possible, and then you'll get to that fully vaccinated state and that most highly protected state as soon as possible. And that's what we need to do.
Deputy Premier, sorry, this morning you outlined and revealed some of the restrictions that are going to be eased at 70%. Alfresco dining, I think retail shopping, you said, is going to be allowed as well. Can you just elaborate and confirm that? And also, is there going to be any gym access as well?
So the first thing is we announced the roadmap that there were going to be a level of restrictions being lifted at 70% and a level of restrictions being lifted at 80% and beyond. At 70%, what we're looking at is the opportunity for individuals, for community and for businesses. We're now working with those businesses, and they'll be in low-risk environments, and as the Premier's already touched on, there will still be a layer of restrictions, the 4 square metre rule, social distancing, capacity numbers in venues. Large gatherings will not be something that you'll see at 70%. Is there an opportunity for alfresco dining, for retail, for outdoor events? Of course there's an opportunity, but we're not there yet. What we're doing now is the work behind that roadmap in what are the opportunities at 70%. But as the Premier's touched on, and as we've touched on previously, there are going to be more freedoms for those that are vaccinated, for businesses that have their staff vaccinated, for individuals that are vaccinated. At 70%, those that aren't vaccinated won't see any additional freedoms in real terms. This is about driving vaccinations up and, of course, rebuilding the community.
We're hearing that cleaners and wardies can't get across the border with Queensland because they're not classified as essential workers.
Well, again, firstly, we have a network of hospitals and a workforce in regional rural New South Wales. What we're seeing in Dubbo, in the Western Local Health District, or far west, no different in the Tweed. Now, in the Tweed, the issue is the cross-border arrangement with Queensland. It is concerning, but I can say that over the weekend, New South Wales officials, along with Queensland officials, have tried to work through a series of new changes. That's been considered today, my understanding, by Queensland Health and the Queensland Government, and we're again to meet tomorrow morning. These are the issues that are hampering workforce flow across that border. Families reunited. What are the authorised workers? Those communities are interconnected and work closely, and service delivery for goods and services is important in the Tweed. So again, we're working towards an outcome to support the Tweed community, of course the southern part of Queensland, but we're yet to land that. Thank you.